My name is Rupa Raju. ఈ రోజు తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లెట్ ఏరియా వారు కండక్ట్ చేస్తున్న ఈ COVID-19 పాండమిక్ తాలూకా ఇన్ఫర్మేషనల్ వెబినార్ కి అందరికీ స్వాగతం. ఈ రోజు మన ప్యానలిస్ట్ లో మనకి TAGC అధ్యక్షులు శ్రీ సతీష్ దండమూరి గారు ఉన్నారు. అండ్ మన ఈనాటి ప్యానలిస్ట్ అండ్ అవర్ డాక్టర్ ఫిజిషియన్ డాక్టర్ అరుణ పెద్దిరెడ్డి గారు ఉన్నారు.
నమస్తే అండి.
సో అరుణ గారు ఈ రోజు మన ప్యానలిస్ట్ కింద ఈ TAGCA వెబినార్ ని కండక్ట్ చేయబోతున్నారు. ఈ COVID-19 అనేది ఈనాడు ప్రపంచాన్ని గడగడలాడించి మనందరికీ ఒక కొత్త జీవన శైలిని విధానాన్ని అలవర్చుకునే ఒక స్థితికి పరిస్థితికి తీసుకొచ్చిందండి. అందుకని 14 సంవత్సరాలుగా TAGCA తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లెట్ ఏరియా వారు ఇక్కడ చుట్టుపక్కల ఉన్న గ్రేటర్ షార్లెట్ ఏరియా ప్రజలందరికీ తెలుగు కమ్యూనిటీ కొరకు సేవలు అందిస్తున్నారు. మన తెలుగు వారు అందరికీ భయభ్రాంతుల్ని చేసిన ఈ COVID-19 ని మనం ఎలాగైనా అధిగమించాలని మంచి ప్రాక్టీసెస్ ని మనం అలవర్చుకోవాలి అని అంటే మనం ఏం చెయ్యాలి? అందరికీ ఉన్న ప్రశ్న ఏం చెయ్యాలి, ఏం చెయ్యకూడదు అన్నది మనందరిలోని ఉన్న మీమాంస. కాబట్టి అది ఒక ఫిజిషియన్ వైద్యో నారాయణ హరి అని అన్న మన వైద్యుల ద్వారా వాళ్ళు పేషెంట్ ని చూస్తారు కాబట్టి హాస్పిటల్స్ లో ఆ ఆవరణ వాళ్ళకి అలవాటు ఉంటుంది కాబట్టి వాళ్ళ దగ్గర నుండి మనకి అరుణ పెద్దిరెడ్డి గారు అలా కొంతమంది వైద్యులు మనకు వాలంటీర్స్ కింద స్వచ్ఛందంగా సహాయాన్ని అందజేశారు. సో వాళ్ళందరికీ TAGCA తరఫున టీం తరఫున కృతజ్ఞతలు. సో ఈ రోజు అరుణ పెద్దిరెడ్డి గారు మనకి TAGCA ప్లాట్ఫామ్ మీద మీ అందరికీ COVID-19 గురించి చెప్పబోతూ ఉన్నారు. ఫస్ట్ 45 minutes to 50 minutes మనం ఇన్ఫర్మేషనల్ వెబినార్ కండక్ట్ చేస్తాము. ఆవిడ ఆ ఇన్ఫర్మేషన్ అంతా మీ అందరికీ అందజేసిన తర్వాత we will open it up for question and answer in Telugu and English. పిల్లల్ని కూడా మేము ప్రకటిస్తుంది ఏంటంటే ఎవరైనా పిల్లలకి ఏదైనా ప్రశ్నలు ఉంటే వాళ్ళని ఆపకండి. వాళ్ళు they can text the question. If you are uncomfortable to ask on the webinar, you can text the question or you can ask the question. Please wait for the question and answer session until the information session is complete. I will announce when the question and answer is open. Then I will also walk you through how you can ask the question one after the other. So now over to Aruna Pedreddi garu.
అందరికీ నమస్కారం అండి. ఈరోజు నన్ను హోస్ట్గా నిర్వహించిన ఈ తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లెట్ వాళ్ళకి అధ్యక్షులకి నా నమస్కారములు అండ్ నా ధన్యవాదాలు. సో మనకి తెలుసు, అందరం చూస్తున్నాము రోజు పొద్దున లేచినప్పటి నుంచి పడుకునే వరకు ఒకటే న్యూస్, టీవీలో కానీ సోషల్ మీడియాలో కానీ ఈ COVID-19 గురించి. ఇప్పటికే ప్రపంచం అన్ని దేశాల్లో ప్రపంచంలో ఉన్న దాదాపు అన్ని దేశాలకి సోకింది. మనం ఎంతో మరణ సంఖ్య కూడా రోజు రోజు చూస్తున్నాం, పెరుగుతుంది. సో ఈరోజు మెయిన్లీ ఇన్ఫర్మేషనల్ వెబినార్ అండి ఇది. తెలుగు అసోసియేషన్ వాళ్ళు ప్రజలకి ఏదో రకంగా సహాయం చేయాలి, కొన్ని వాళ్ళ సందేహాలని తీర్చాలి అన్న ఉద్దేశంతో చేశారు. సో ఫస్ట్ రూప గారు చెప్పినట్లు, రూప గారు థ్యాంక్స్ అండి for doing this, and Satish garu thank you also. So first 40 to 45 minutes I'm going to talk like briefly about asli coronavirus enti, ekkadi nunchi ochindi, manam em cheyali, idi andari బాధ్యత. గవర్నమెంట్ చేసేది గవర్నమెంట్ చేస్తుంది, మనం చేసేది మనం చేయాలి. So main aim here today is how to prevent it and how to prevent the spread of this virus. So అందరూ రెస్పాన్సిబుల్ గా ఉండి చేయాలని నా కోరిక. సో లెట్స్ స్టార్ట్ అండి. అసలు వాట్ ఈస్ దిస్, నేను కొన్ని స్లైడ్స్ ప్రిపేర్ చేశానండి. సో ఐఎమ్ గోయింగ్ టు షేర్ విత్ యూ ఆల్. వన్ సెకండ్. కెన్ యూ ఏబుల్ టు సీ ద స్లైడ్స్ అండి?
Yes, sir. Yeah.
So first of all, what is this coronavirus and what exactly is COVID-19? So coronaviruses are a big family of viruses, and as you all know, like virus is the smallest microorganism. It's much lesser than bacteria. So coronavirus family lo chala viruses unnai. Like manaki usually common cold viruses only, they all belong to coronavirus, and there are different subcategories, alpha corona and beta corona. So this COVID-19 belongs to one of the coronavirus family. So what is COVID-19? COVID-19 is coronavirus disease because it started at the end of 2019 in China. That's why the name came. And it's also called novel COVID-19. Why? Because novel is because it was never invented in human beings. This virus is thought to belong to animals. So what is a pandemic? Now we are hearing, right, the World Health Organization considering this as a pandemic, because pandemic is basically a global outbreak of the disease. So even though it starts at one region, and then after some time it spreads to the whole globe. So manaki idi kotta kaadu pandemic. We had these pandemics before. Largest pandemic we had in the world was in 1918, which was a Spanish flu. We had a lot of deaths and millions of people were affected with this. So the other pandemics we had, I just want to have a, have you guys know what is pandemic and whether this is the whole new thing. No, it's not new, but we did have before. So there was Asian flu in 1957 and there was Hong Kong flu in 1968. And also recently in 2019, we had H1N1 pandemic. So I just want to go briefly, a few lines about Spanish flu. So which happened in 1918. This was the most deadliest pandemic. So it was caused by a virus they named as H1N1. So it affected 500 million people, almost that's like 1/3 of the world population was affected by this virus. And there were also a lot of deaths from this virus. I didn't even know until recently I started to search about Spanish flu. There were about 50 million people who were dead, which is very sad. And even in the United States, there were 675,000. So this is just a picture of the Spanish flu from 1918. So let's go back to COVID-19. So what are the symptoms of COVID-19? When do we have to worry about this? So the most common symptoms are 3 and CDC చెప్తుంది కదా. But these 3 symptoms are seen most of the times, these 3 symptoms are seen, but there are also other symptoms. So first ఏంటంటే జ్వరము, fever, and fatigue. A lot of people complain of like a severe weakness, fatigue, and also dry cough. The other symptoms are like flu symptoms, any flu symptoms, lot of body aches, runny nose, sore throat, and shortness of breath. Shortness of breath is becoming also very common for patients. Ayasam. And then some people are also presenting with just gastrointestinal symptoms like diarrhea, like loose stools. So I have this slide comparing the symptoms of flu, allergies, and common cold. Especially this side of this time of the season, like a lot of patients have seasonal allergies to pollen. So there are very similar symptoms for COVID-19 and cold and flu and allergies. So as you see here, we don't see fever in allergies, and common cold we can see low-grade fevers, or we don't have to see. But the most common symptoms for COVID-19 again are fever, dry cough, and shortness of breath, and headache. Actually, some people are complaining headaches too. So as everybody is at risk of having COVID-19, whoever is getting exposed, they're all risk. But there are certain disease, like certain number of people, like certain people with certain conditions are very high risk. Like say any chronic conditions, like people who have asthma, chronic lung diseases, heart problems, diabetics, elderly people, especially after 65 years of old, and people who have cancers, HIV positive patients. All of these people are categorized under high risk. So be careful if your family members have any of these problems. They have to be extra careful. So how does this spread? Why we're worrying about it? Why it's not like other common cold viruses or flu, but this is different because this is very highly contagious. So there are three ways of spreading the virus. One is through respiratory droplets. Droplets అంటే చిన్న చిన్న మనం తుమ్మినప్పుడు కానీ దగ్గినప్పుడు కానీ ఈవెన్ మాట్లాడినప్పుడు కానీ మనందరము డ్రాప్లెట్స్ రిలీజ్ చేస్తాం. సో ఈ డ్రాప్లెట్స్ ఇస్ ద మెయిన్ సోర్స్ ఆఫ్ స్ప్రెడ్ ఫర్ దిస్ వైరస్. So because of the droplets, between two people, if they are in close contact, if one person has symptoms, especially this is between 3 to 6 distance low, it's easy to transmit. And the other one is when we have the droplets, they fall on the objects wherever we are, either tables or like phones or anywhere. So and when we touch those surfaces with our hands, and before we wash the hands, if we touch our face like mouth, nose or eyes, that's how we get the disease. We get the virus into our bodies. The main thing is don't let the virus go into your body, either mouth, nose or eyes. These are the three main areas where the virus can enter into your body. So, and the other thing is, there are also situations where people can transmit the disease without any symptoms. So that's a little bit worried, but that's where we have to be extra cautious too. So how do we stop the spread of disease? So now we know how the virus is spreading, right? So now the measures are how to stop it. So as we all know, number one thing is hand washing with soap and water. You have to wash thoroughly all areas of the hand, including back of the hands, in between fingers, and also the tips of the fingers. So that's the most important thing, going outside or, frequent hand washing, and also avoid contact with people, especially who are sick, and cover your coughs, sneezes. If you think you have any symptoms, it doesn't need to be COVID-19, but cover your coughs and, sneezes, and avoid touching your eyes, nose, and mouth, because this is how the virus go into your body. And also try to disinfect all the areas, clean and then disinfect. If you are sick, you stay home. So the same thing, this is the way we prevent, hand washing. Again, I would like to stress more on the hand washing, and especially children, you have to properly hand wash. And also, if you have any symptoms of this, don't just go to the doctor's office, but call your healthcare provider before you go there. And they will advise you what to do, because not all the situations you have to go to the doctor's office, and you don't need to get tested all the time. So call your doctor. So the other preventive things, as I mentioned again, the best way to prevent this is to avoid being exposed to the virus. So currently there is no vaccine, but they are researching on developing the vaccine, but so far there is no vaccine. So wash hands again. If suppose you are in a place where there is no water and so far that's available, then you can use the hand sanitizer, but make sure it has at least 60% of the alcohol in it. So again, cover coughs and sneeze. If you are sick, regarding using of the face mask, I'm going to cover it again. But there are few recommendations which are different from CDC and World Health Organization. But if you are sick, you can use a face mask. But asymptomatic people, they're not recommending to use face masks, because as you know, healthcare providers now are facing a lot of issues with the PPE, which is protective equipment like masks and gowns. So they need to have readily available. And also I'm going to talk about face masks also, when to use them. So the other preventive method I mentioned was like clean and disinfectant. So if any surfaces are dirty, first clean them with, you can use soap and water, and then after that you can disinfect them. Disinfectants, you can use any EPA approved things like bleach solution. You can mix like bleach solution with water at home. And the other surfaces like carpets, rugs, and drapes, you can wash with like soap and water. So we use electronics every day, right? We adults use, kids use it. So it's better to use a wipeable cover on top of these things so that it will be easy to clean. So when you can use any alcohol-based wipes, but they have to be at least 70% alcohol and dry it thoroughly. So laundry, like if you are going outside and you think you got exposed to something, you know, make sure you come home and you wash clothes appropriately with the warmest water setting. So the other thing I mentioned was social distancing. This is very, very important. Please follow social distancing because this is the best method to prevent. Every day we are seeing like how many new cases are coming, especially in the United States, and how many deaths we are seeing. So the best preventive thing is social distancing. A lot of people are not taking this very serious, but please take it very serious because I'm hearing a lot of, you know, when people are going into the hospital, how many cases are increasing, admissions into the hospital, you know, issues with these masks, you know, doctors are, you know, facing a lot of issues like when they come home, you know, they have to be isolating themselves. So it's our responsibility, it's everybody's responsibility to do social distancing. So you have to stay at least 6 feet from each other. Please do not gather in groups, and also mention to your kids and educate them and encourage them. I know it's boring to stay at home, but kids also needs to know, like, you know, it's about social distancing. So you stay out of crowded places and avoid mass gatherings. And especially when people are sick, social distancing is very important. You know, we need daily things. We need a lot of things. You know, either people who are on routine medications, we have to go to the pharmacy and get medications, like daily food items, you know, milk and groceries, all those things. But we have to think of alternate options even for those. You know, we can do mail order medications and try to do it a little bit earlier so that you don't run out of medication. You know, a lot of my patients are also like, we are educating them, you know, to call a week advance before you run out of the medications, so that there will not be a delay. And grocery stores, you know, I pass through the grocery stores every day when I'm coming from work, and I'm surprised, you know, how many cars I see at the grocery store. That's very worrisome. You know, there are a lot of options to deliver groceries, you know, you can utilize. If suppose you have no option like that and you have to go to the grocery stores, you know, maintain your social distance. And when you come back home, you know, make sure you properly clean your hands and, you know, take proper precautions. So what if someone is sick? Someone is having symptoms, and you don't know whether it's COVID-19 or it's common cold, or if it's flu. It can be. Not everybody who is sick doesn't need to be COVID-19. So this you have to remember. So you don't have to get panic as soon as you get a little like a runny nose or sore throat, or, you know, because the first thing we are also making sure for patients is to rule out other issues like flu. You know, there is a lot of flu around here nowadays. This is the flu season. There are a lot of allergies. So, you know, stay home. You can, if you think you're sick, you know, you try to stay home and, you know, maintain social distance. You cover your coughs and sneezes, and you can keep in a separate bedroom and bathroom. Suppose one person is sick, as I said before, like all COVID-19 patients, even if they're diagnosed, they don't need to be in the hospital. So they can stay home because 80% of the cases are milder. You know, we don't have to do any treatment except like, you know, symptomatic, or drink a lot of water and take rest. But the important thing is do not spread it. Do not spread to the other people, even into your family members, especially if you have your parents or people who have a lot of chronic medical conditions, as I mentioned before. It's very, very important you stay isolated from them. If you are sick, and if you are suspicious COVID-19 or you are positive for COVID-19, you need to isolate yourself in your home itself. So a few tips for those things is like, you make sure you have all the cleaning products with you so that you can clean after yourself, and use a separate bathroom if possible. If you don't have that opportunity, you know, if you are sharing a bathroom, Then make sure you clean and disinfectant everything after each use. And you need to keep your own dishes, own utensils, and then make sure you wash it. So also trash, also you have to use a separate trash. It's not only sick people, and we are hearing a lot of healthcare providers, including me, because we have exposure. So we are managing, I know a lot of spouses are also saying, like when the husbands or wives are going and taking care of these sick patients, they come home, they're staying, some people are staying in the basement, some people are staying in the garages, they're trying not to expose to their family members. So this is also important if anybody is sick. So if people are sick, there are different stages, and one is milder symptoms. They may have milder symptoms, but always call your healthcare provider. There are a lot of helplines in the Charlotte area. Atrium has helplines. They have telephone calls, and they also have virtual visits. So a lot of your questions can be answered through these things. But if anybody, you or your family members, are having these signs, these are like emergency warning signs, you either call 911 and you need immediate medical attention. Like if you have trouble breathing, like some severe shortness of breath, or a pain in the chest, or you notice like people are confused or unable to be arousable, or if you see any bluish lips or face, so that's like an emergency. You need to call 911. So I hope, this is clear on, what is COVID-19, how it spreads, and what are the ways to prevent it, that it's everybody's responsibility. So next, is there any treatment for COVID-19? So currently, we are hearing in a lot of social media, like a lot of medications, like these malaria medications we were using when we were in India, and like antibiotics like Zithromax and a lot of other antiviral medications. But so far there is no FDA approved medication. So right now, they're recommending supportive care, rest, fluids to relieve these symptoms. But there are, a lot of hospitals are following their own protocols. People are using some of the medications, but that has to be under the guidance of a physician. And my sincere request is, do not take any medications on yourself. Like, if you have people sending you medications from India, or if you already have these anti-malarial medications, please do not take it. Always consult your doctor. And you really don't need it if you don't have symptoms, or if you have milder symptoms. These treatments, if they want to do it, it's only under the hospital setting when people are very severely ill, because these medications are very toxic and they have a lot of side effects, and they have a lot of interactions also with other medications. So please be careful. Do not take yourself, or do not prescribe to your family members. So I just want to also keep like little few slides about pregnancy, because a lot of patients are asking whether pregnant people are they at high risk, what to do if they get it, is the baby going to be high risk? As we know, like COVID-19, we don't have like much information, because I think we don't have enough time to studies. For the studies or researches, but a lot of studies were done in Wuhan, China. So far, whatever we know, what they're same things, same measures even for pregnant people. Whether pregnant people are at high risk having a COVID-19, we don't know yet. So there are a lot of things, but they had to take more precautions. Same thing as I mentioned before, hand washing. They also have to try to avoid going to the office visits, like doctor's visits. Usually they go routinely, so they can utilize the teleservices or virtual visits, or healthy diet, and as usual. One sec. So if you, even pregnant people, if they're having any symptoms of cough, any of these symptoms, please call your doctor and take advice from them. Whether, the other question is whether the pregnant people, if they're infected with COVID-19, are they going to pass into their fetus? So for sure, they don't know, but in a study that was done in Wuhan, I think they studied for 9 pregnant women who were COVID-19 positive. I think only 2 infants, two babies that were born had some signs of symptoms, but no adverse effects, and they didn't have severe symptoms, the pregnant people. So that was the only study I came across. So the other thing is, so we all have to, do your part to slow the spread. So working and schools are the main things. I know this affected all our lives, daily routines. The lifestyle has changed for all of us. So try to work from home as much as you possible. And now all kids have like online schooling. So when we are doing all these things, working from home and, taking classes for school online, there's no point of kids having, going outside and having like few friends and playing together. There is no point. It's not going to be useful. We are working, like we're trying to isolate from one side, and on the other side, kids are, having groups of friends. I know it's boring, but limit as much as possible, and you can try to play the games that doesn't involve like physical contact, and also at the same time maintain distance, and make sure you wash hands. So I'm talking to a lot of kids. I know they're not going to be happy what I'm telling them. You have to stay in house. You have to do a lot of stuff also. This is the time. This is the opportunity. Take this opportunity to do a lot of new things in the house. You can learn music, or you can learn a new language, or you can, learn cooking, because I know all kids are always busy, and they don't have time to do, like, try some new things. That's what I tell my son, start cooking or gardening. There are a lot of pleasure things that you can enjoy, and also spend time with your family. This is a good opportunity to spend time. So please don't go for shopping trips, social visits, and you can use the drive-through things, pick up and delivery options. Also, the other thing, most vulnerable people are the nursing homes and long-term care patients. Please avoid visiting them. A lot of nursing homes are not letting visitors, even their own family members, but that's very important, because once any nursing home, one case comes, it's very, it spreads so fast, and a lot of people are getting affected. And at this age, the mortality rate is very high. That means they can get very severely sick. So the other thing I wanted to mention is, some people are asking, like, I have my routine doctor's appointments, should I cancel them? Yes, any non-essential and non-urgent appointments, the CDC is also recommending to cancel appointments. If there are some appointments that you cannot postpone, or something needs like a physical exam, because something like the doctor has to see. Nowadays, a lot of people are doing virtual visits, so please utilize that option. If you really have to go, you call the doctor ahead of time and follow the doctor's instructions. So when we're facing all this COVID-19, right, every day we are listening to this news, how many people are getting affected and how many people are dying. It is sad, but we have to, keep also positive things. This is going to go over. We may invent the vaccine, but it might take some time. But, how to cope up with the stress. A lot of people, they get anxious. I mean, I'm getting few calls that they're not able to sleep, and they're worrying about whether they're going to have the COVID-19 or their family members. There is no reason to worry, Andy, but you have to be very careful. You have to prevent everything, but there is no reason to worry. There are some things to cope up with the anxiety and stress. Take a break from social media and news. When we hear like the whole day about this news, it is really a little bit upsetting. So take a break and do something else. As I mentioned before, either people who like meditation, pranayamas, yogas. You can do you engage yourself in some other activities other than just watching social media every day. And also maintain your healthy diet, exercise, and get enough sleep. And some outdoor activities as long as there is not a group of people. Still maintain the social distance. So do not isolate yourself, especially for people, a lot of my patients, they live alone. So do not isolate yourself. Try to talk to people who can support you. And, actually myself, I'm able to speak to a lot of my friends who I have not been speaking to them for a long time. It's very nice, like when people think about you and they call you and they ask you, how are you doing? Do that, try to call, your friends that you have not been in touch with for a long time, so and also the other thing I want to mention is, people who are at risk. I don't know whether I mentioned before, smokers. People who smoke, they're also at a very high risk of getting COVID-19. So at this time, I would like to take an opportunity for people who are smoking, please, this is the time to quit smoking. So here, I put like a lot of questions lot of people have questions. Where do we go for testing? So I tried to collect something around the Charlotte area. Novant has a lot of locations, and Atrium also have. I don't know whether you can see in Matthews and Charlotte, they have locations where they can do the testing. And again, please call them and make an appointment if needed. Usually the healthcare providers, they do screen. Even Atrium, I think they have like a self-check questionnaire online. So you go to that questions, and if you need, you talk to your healthcare provider. They are the ones who will decide who needs testing and who does not need testing. As I said, not everybody who has symptoms may not need testing. So we do have in our population, మన తెలుగు people, మన parents వస్తూ ఉంటారు. So వాళ్ళకి ఎవరికైనా health insurance లేని వాళ్ళకి, and if they are not feeling well, there is a federally qualified health centers. They are located in all locations. This is a community-based health clinic, but they receive like federal funds. So you can call one of those clinics if you need and they don't have insurance. And if you are not able to see any of these clinics, please call your local health department, either North Carolina Health Department or South Carolina Health Department. They will guide you. People who have insurance, of course, you can call your healthcare providers. So for any medical emergency, please call 911. So I put like some of the, some of the counties. I was not able to put all the counties, but I know we have people in South Carolina too. So this is the Union County, Cabarrus, and this is Mecklenburg. And there is a site, there are a lot of these free and charitable clinics, and this is a website. If you click on this website, there are multiple clinics come, and whatever is the closest location, you can use it. So from all the healthcare providers, this is a sincere request. So all the healthcare providers are working at the hospitals, clinics, nursing homes, risking their lives. So they are staying there for you, and they want you to stay home. That's the biggest help you can do for healthcare providers. Okay, so that concluded my information. I tried to get information from CDC, World Health Organization, but this is only informative only. If you have any regarding your health or any other concerns, you don't always have to call your healthcare providers, but I'm willing to take some questions. Rupa garu.
Yeah. So thank you, Arna garu. I think we can switch out of this screen, Satishwar. Thank you, Andy. ఈ రోజు ప్రజల్లో ఆరోగ్య భయాలు, ఆహార కొరత, సమాచార తర్జుమా ఇవన్నీ ఉన్న తరుణంలో మీరు చాలా సింప్లిఫైడ్ గా, I know it takes a lot of time for the physician to take out time and put it so well in slides. So నాకు కూడా తెలియని ఇన్ఫర్మేషన్ కూడా కొంచెం వచ్చింది. So we have quite a number of callers, in the sense చాలా మందినే ఉన్నారు. అండ్ థ్యాంక్ యూ ఆడియన్స్. అందరూ మన తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లెట్ ఏరియా వారు ప్రొవైడ్ చేస్తున్న ఈ రోజు ఈ వెబినార్ ని అటెండ్ అయినందుకు. సో మనకి చాలా క్వశ్చన్స్ ఉన్నాయి, చాలా మందికి చాలా డౌట్లు ఉన్నాయి, దీనిలో పిల్లలు కూడా వచ్చి ఉన్నారు. సో వన్ థింగ్ దట్ ఐ వుడ్ లైక్ టు సే బిఫోర్ వి ఓపెన్ అప్ ఫర్ క్వశ్చన్ అండ్ ఆన్సర్ ఇస్ దట్ ప్లీజ్ కీప్ యువర్ సెల్ఫ్ ఇన్ మ్యూట్ లోనే ఉండండి. మీకు ఏమైనా క్వశ్చన్ ఉంటే అక్కడ రేజ్ యువర్ హ్యాండ్ అని ఒక బటన్ ఉంటుంది, ప్లీజ్ ప్రెస్ ఆన్ దట్, అండ్ ఇన్ ద ఆర్డర్ దట్ ఇట్ వాజ్ రిసీవ్డ్ ద మోడరేటర్ విల్ ఓపెన్ యూ అప్ ఫర్ అ క్వశ్చన్. మీ ప్రశ్నను మీరు అడగండి. మీరు తెలుగులో అడగాలి అనుకుంటే తెలుగులో అడగండి, అరుణ గారు తెలుగులో సమాధానం చెప్తారు. ఇఫ్ యు ఆర్ మోర్ కంఫర్టబుల్ ఇన్ ఇంగ్లీష్, యూ కెన్ ఆస్క్ యువర్ క్వశ్చన్ ఇన్ ఇంగ్లీష్. Please pertain the questions to medical questions on COVID, not on, please do not take names of stores or, people or alternative medicine or, experimental drugs, which, we will not be able to particularly answer, because this webinar is basically to inform you of the guidelines, as we are also following the CDC guidelines. And unmute yourself, yes, and in case you are not comfortable asking your question on video here in the Zoom session, what you can do is you can text it. They have been kontamandi adigunnaru ante memu text cheyacha ani adigaru 9802138240. You can text your question to that in English and or in Telugu as well, and I will moderate that question to Aruna garu with your name, and you will get that answer. And we will try to open up to some of the chat questions depending on the mana samayabhavam kuda chusukovali kabatti dani batti manam chestunnamu. Aruna garu gurinchi nenu beginning lo పూర్తిగా చెప్పలేకపోయాను. సో ఆవిడ న్యూయార్క్ నుంచి మూవ్ అయ్యారు, 19 years నుంచి మెడిసిన్ ప్రాక్టీస్ చేస్తున్నారు. వారి స్వస్థలం గుంటూరు మెడికల్ కాలేజ్ లో చదివిన్నారు, అండ్ షార్లెట్ లో 4 years నుంచి చేస్తున్నారు. వన్స్ అగైన్ అరుణ గారు, థ్యాంక్ యూ సో మచ్ ఫర్ హెల్పింగ్ us out today, and I think we will be opening up to question and answer sessions.
హలో,
చెప్పండి, మీ పేరండి?
నా పేరు హేమ్ అండి. ఇదే మనకి టెస్టింగ్ ఫెసిలిటీ జస్ట్ ఇన్ కేస్ ఇఫ్ ఎనీ మన ఏపీ వాళ్ళు ఎవరైనా సరే సపోజ్ కరోనా సిమ్టమ్స్ ఉన్నాయనిపిస్తే ఏమన్నా వర్చువల్ వీడియో కానీ ఏమన్నా అలా అరేంజ్ చేయగలరా? అంటే అలా ఏమన్నా పాసిబిలిటీ?
అంటే దిస్ ఈజ్ అన్ ఇన్ఫర్మేషనల్ వెబినార్ అండి. మీరు ఈ పాయింట్ ఆఫ్ టైం లోని, మీరు ఈ 1 hour లోని మీకు ఏమైనా క్వశ్చన్స్ ఉంటే మీరు అడగచ్చు, టెక్స్ట్ చేయొచ్చు అన్నది. ఇట్ ఈస్ ఓన్లీ ఫర్ ది రిలేటెడ్ టు దిస్ పర్టికులర్ సెషన్.
అదే అండి నేను అడుగుతుంది. ఇప్పుడు ఎవరికైనా కరోనా అని డౌట్ వచ్చింది అనుకోండి, ఏదైనా ఈ జూమ్ వీడియో ద్వారా ఏమన్నా పరీక్ష చేసి మెడిసిన్స్ అది ప్రిస్క్రైబ్ చేయగలరా? జస్ట్
అది ఐ థింక్ దట్ ఈస్ దేర్ యాజ్ పర్ ద సిడిసి వెబ్సైట్ లోకి మీరు వెళ్ళి చూస్తే there is a particular number that you can call. I think so కదా అరుణ గారు? The Surgeon General has
మీరు ఎవరి గురించి మాట్లాడుతున్నారు, కొంచెం డీటెయిల్స్ చెప్తారా?
ఎవరి గురించి కదండి, జస్ట్ ఇన్ కేస్ మనకి ఏమన్నా
అంటారా? నేను ఇందాక స్లైడ్స్ లో చెప్పినట్లు మీకు సిమ్టమ్స్, మైల్డ్ సిమ్టమ్స్ ఉంటే you can wait, because not all the symptoms are COVID-19 kada. So if you think you are suspicious having COVID-19, or you are exposed to COVID-19, or you are around people who were positive for COVID-19, then ఇప్పుడు మన ఏరియాలో అయితే APM and Novant కి హెల్ప్ లైన్స్ ఉన్నాయండి ఆన్లైన్. You don't have to go to the doctor's office, you don't need to go to the urgent room, and we are strongly discouraging for milder symptoms. So checklist వెళ్ళి, if you put the checklist your symptoms, they will guide you what to do. What is the next step? You know, even for COVID-19 suspicious patients unna kuda, they may not recommend you to go to the doctor's office, or they can guide you to go to a testing center where they can do the testing. Some people are doing outside, some people are doing in the cars. So, you know, you follow their guidelines. You know, I provided some information on that, where what clinics, you know, there are, do the online calling, you know, telephone calling or online checklist. You know, I think CDC is, everybody is stressing on, don't go to the doctor's office, because one is, you going to the doctor's office, if suppose if you are not sick, you are getting exposed to the, you know, other people there might.
Yeah, I think that's the question that he was asking, that if we could do a Zoom call, but I don't think that's provided in Zoom. CDC, I would recommend that you, like Karnagar Jepnattu, this webinar also is recorded, and it will be displayed in social media sometime tomorrow or in the next few days. So you can go back to the slides and you can see there are a couple of slides where meeku information undi. Meer dani meeda click chesi online velte, you will be able to, you know, get an answer for that question. So next question please.
Okay.
Hello andi, na peru Shiva Indrakanti.
Hello, చెప్పండి మీ క్వశ్చన్.
Aruna madam garu, actually slides lo mention chesaru, like the people are little bit anxious ani. Like if a healthy person, endukante last 2-3 months nunchi so many things has transpired, but lockdown is happening in the last 3 or 4 weeks, but you might have exposed before that. Though I'm healthy person, I just want to get out of that anxiousness. Is there a way I can go to a nearest doctor's office and get checked up and clear off my mind?
Okay, Andy, that's a good question, Andy. మీరు అంటే 3-4 వీక్స్ నుంచి లాక్డౌన్ లో ఉన్నాము, బిఫోర్ 3-4 వీక్స్ ఎక్స్పోజ్ అయితే ఏంటి అని కదా మీ క్వశ్చన్?
Yes, I think that's his question. అంటే 3-4 weeks ముందు, అంటే లాక్డౌన్ కి ముందర ఎక్స్పోజ్ అయ్యి ఉండొచ్చు కదా. So otherwise he is healthy. What if he's asymptomatic? You know, if he wants to go get checked by the doctor for his, sanity, what should he do?
ఓకే అండి, ఇఫ్ యూ హ్యావ్ బీన్ హోమ్ అండి, మీరు ఇంట్లోనే ఉండుంటే 3-4 వీక్స్, అంటే మీ ఇంట్లో ఫ్యామిలీ మెంబర్స్ కూడా 3-4 వీక్స్ నుంచి ఇంట్లోనే ఉండుంటే, అండ్ మీకు ఏమి సిమ్టమ్స్ లేకపోతే, ఇన్ మై ఒపీనియన్ యూ ఆర్ వెరీ సేఫ్ అండి. మీరు డాక్టర్కి కాల్ చేసినా కూడా they are going to, you know, monitor your symptoms as long as you are not going outside and you didn't get any exposure. Usually 14 days only. If you are home and you don't have any symptoms, suppose you were exposed to somebody at work before and you are now 14 days away, 3 weeks away, 4 weeks away, and you don't have any symptoms, it's nothing to worry, and it's nothing to worry. Unless if your family member is a healthcare worker, you know, that's a different scenario. But you are saying like nobody went out or something like that, so you are safe.
So I will take only another 10 seconds, madam. Just a follow-up question. Because of this pollen content in the last 2 days, emaipindante naku just like, you know, I'm getting this itchy eyes or like, you know, sneezing. So that makes me a little bit psychologically, you know, thinking about this one. Any answer, madam?
Okay, sure అండి. ఇది యాక్చువల్గా మీరు అడిగే క్వశ్చన్స్ మాకు ఆఫీస్లో కూడా చాలా మంది పేషెంట్స్ ఎవ్రీడే వీఆర్ ఫేసింగ్ లాట్ ఆఫ్ ఫోన్ కాల్స్. పేషెంట్సే కాదండి, ఇంట్లో కూడా మా పాపకు కూడా అలర్జీస్ ఉన్నాయి. యాజ్ యూ సెడ్, ఇట్స్ అ లిటిల్ బిట్ worrisome, but the positive thing is you have been home for 4 weeks. That's the best thing. And pollen allergies, like you know symptoms what you had before, so you take the allergy medications and you see how you're doing. If anybody andi if pollen allergy unna lekapoina, if you are having some symptoms and it's not getting better, they're getting worse, you know, worrisome symptoms like fever ala. Allergies usually you don't have any fever, so any worrisome symptoms unte, you call the healthcare provider.
Okay, thank you, Anna garu.
Thank you very much.
So from now on, the next questions ki we would please ask you to ask one question because we have a lot of people and we are open for the next question. After that, I will give a question which has been sent by a person on the text. So go ahead, next caller please.
అరుణ గారు, నా పేరు నితిన్ అండి.
నితిన్ గారు చెప్పండి మీ క్వశ్చన్.
నా క్వశ్చన్ ఏంటంటే అండి, అంటే ఆఫ్ లేట్ న్యూస్ లో ఐ థింక్ దిస్ వైరస్ ఇనీషియల్ గా వచ్చిన దానికన్నా ఇట్స్ చేంజింగ్ ఇట్స్, అంటే టెక్నికల్ టర్మ్ లో ఏమంటారో కరెక్ట్ గా ఐడియా లేదు కానీ మేబీ ఇట్స్ షేప్ ఆర్ సంథింగ్. ఈ సిమ్టమ్స్ ఖచ్చితంగా వస్తాయంటారా, లేకపోతే నేను రీసెంట్ గా అంటే మరి ఐ డోంట్ నో హౌ ఫార్ దట్ ఈస్ ట్రూ, బట్ నేను ఈ సిమ్టమ్స్ లేకుండా కూడా పాజిటివ్ గా టెస్ట్ అయిన వాళ్ళు ఉన్నారని అంటే న్యూస్ లో విన్నదే ఇది. ఐ డోంట్ నో హౌ ఫార్ దట్ ఈస్ ట్రూ. అంటే లైక్ వితౌట్ ఫీవర్, వితౌట్ ఏకీ హెడ్, డైరెక్ట్ గా రెస్పిరేటరీ ప్రాబ్లం రావటం.
అవునండి, మీరు చెప్పేది యాక్చువల్గా కరెక్టే. ఇప్పుడు నేను చెప్పిన సిమ్టమ్స్ అవి మోస్ట్ ఆఫ్ ద టైమ్స్ వి సీ దోస్ ఫీవర్, dry cough and shortness of breath. Most commonly the symptoms are there, but it doesn't need to be the same symptoms for all situations, even if people have COVID-19. As I mentioned before, I think I mentioned in one of the slides before, there are also asymptomatic patients. COVID-19 patients andaru sick avalsina avasaram ledandi. There are some group of patients like you don't know the symptoms, which is good for the patient, but it's not good for the other people because you can still get, it can still be transmissible from that patient. So that's why we are following the social distance. That's why we are telling all these things to avoid to the grocery stores. If a person is sick, we know that they are sick and we stay away from them, but not the case like that. If people are not symptomatic, you are right, and the people don't have symptoms, but they can still have COVID-19. That's the reason we have to be extra careful. That's the, not only that, and the other scenario, and the other one is even people who have symptoms and they're going for testing, right? Commonly we are doing this nasal swab. They take a swab into your nose and they they send for testing. So 30% of these tests are coming negative, even though they have COVID-19 positive. So first time they're coming negative. Next time also they were, I heard a case like 2 times the test was negative, and the third time the person got severe symptoms and they had to be admitted to the hospital, and then they went through tracheal secretions and that was positive. So people can be asymptomatic. You can get, the disease, they can still spread the disease, or people may have COVID-19 and the test might be negative. So these are the 2 things we have to be extra careful. These scenarios are the ones like, I think, spreading more. How the disease, how fast the disease is spreading. These are the, unique features of this virus. So that's why it's most contagious. Okay. And also, I think you said something like people are going with sudden onset of symptoms, right? Yes, Andy. I heard from a lot of my friends who work in the hospitals, people have no symptoms and they will have a sudden onset of shortness of breath, and they're getting admitted and they're positive for COVID-19. And one of my patients I had experienced, she had a fall, like a casual fall. She tripped and she fell and she broke her ankle. And she went to the hospital 2 days after she was, positive for COVID-19, and she never had any symptoms. So this is where we have to be careful. This is where we are stressing: do not go to doctor's offices or emergency rooms if you really don't need to be, because you don't know what you are getting exposed to. I hope I answered.
Thank you, yeah, I think that really answers.
you did, Andy. Thank you, Andy.
Thank you, Nitin garu. Now we are going to open up to a question from a teenager, child. So the next question, it's open. Please go ahead. Go ahead. We had a request for a question from a child. Sunita garu, please go ahead. You're unmuted. Can you hear us? Yeah, we can hear you. Go ahead.
Hello. This is a news, and I have a question. So, there's no cure for coronavirus, and some people have still recovered. How do they recover if there's still no cure?
Okay, good.
How do they recover when there's still no cure? Okay.
Good question, Amma. You know, COVID-19 has no treatment now. FDA approved treatment, there is no treatment at this time. Okay, you said some people who has COVID-19 without treatment, they recovered. Yes, lot of people, about 80% of people, they do not need any medications. They just need supportive measures, you know, and the main thing is they have to stay away from people. Yes, 80% of the people will recover without any intervention or any hospitalization. They can stay home and they take precautions not to spread, and they take like, you know, symptomatic treatment, supportive treatment like, you know, that of liquid, you know, that kind of stuff.
Okay.
Thank you.
Thank you for that question, Anusit. It's interesting to hear children ask questions. So
Thank
I
you.
encourage all the parents to, you know, if your child has a question, encourage them to attend these set of webinars. Manaki ee roje kaadu వచ్చే ఆదివారం కూడా ఉంటుంది. So please have the children engage themselves in questions like this. It took him a quick minute to ask, but it was a very pertinent question, and you know, they understand the gravity of the situation. మనకి చాట్ సెషన్ లో చాలా కొన్ని క్వశ్చన్స్ వచ్చున్నాయండి. సో సతీష్ గారు విల్ బి ఆస్కింగ్, రీడింగ్ అవుట్ అ క్వశ్చన్ ఫ్రమ్ ద చాట్ సెషన్. సతీష్ గారు.
Actually, chat session lo almost 8 questions వచ్చినాయండి. I'll go for the first one. This one you lightly already touched upon. This question is from Hindu Priya. Can you get COVID via open wounds?
Open wounds. Okay, good question, Andy Hindu Garu. So far, it has not reported. As far as my reading into CDC or other sites, so far not reported from open wounds. But this virus is, you know, COVID-19 is, it mainly attaches to the respiratory cells. You know, with the virus anatomy or whatever, the respiratory, you know, mucous membranes of the lungs are mostly vulnerable. But in some of the studies, you know, they have found viral loads in the feces of patients. And very minimal viral load was found in the blood. You know, sometimes when we have infection, especially for bacterial infections, you know, whatever the area we get affected, either the skin or kidneys or lungs or sinuses, you know, sometimes it can go into blood. And when we do the blood cultures and stuff, you know, it can be found in the blood. But, you know, there are certain viruses also we can find in the blood. But this particular virus, I have not read anything from the open wounds. There was a transmission. But at this time, you know, there may be some, but I didn't come across. And it's most mode of you know, transmission is through the mouth and you know, nose and eyes.
Okay, thank you, Andy. Thanks for the question. Now I'll go to a question that I got on text. After that, we will take a caller. So this is kind of, I'll not mention some stores names. You know? I went to Indian store and a halal meat store 1.5 weeks back. No one was wearing masks, neither was I. Now I heard in India that one of the meat shop butcher has tested positive and died in a remote area in Guntur. What should I look out for? I heard the same in NJ. I'm very worried.
Okay, Andy, good question, Andy. So you're worried about when you go to Indian stores, what is the chance of you getting COVID-19?
Mm-hmm.
At this time, Andy, it's the same precaution. So we, you know, CDC is not advising anybody to go to any stores if you really don't need it. You know, pick up the online, or some of them are doing curbside deliveries. Whether you can get COVID-19 from within the store, yes, as I mentioned, there are asymptomatic people. If you are close enough to them, or touching, if a symptomatic patient is touching some of the packets or coughing or sneezing, and you're touching, and then you touch your mouth and nose or mouth, you can get that way. Getting from butchers, I'm not sure what kind of exposure he had. Whether are you asking about them from the meat, or are you asking about if he's symptomatic, it comes to the meat and you are bringing that home?
He didn't mention that, but I think he's worried that, he has heard something from India that one of the butcher who came back from Delhi, from the Jamaat, he died of COVID. So after his exposure to COVID, he has still done the meat cutting and stuff. So does that same thing apply here as well, Kada? So I'm worried because I also bought stuff 10 days back and Ankunta in this.
Okay, got it. So if suppose the butcher has COVID-19, suppose we assume that he has COVID-19 and he's symptomatic. First of all, he's not supposed to be working if he has symptoms. So suppose whatever, if he has symptoms or he doesn't have symptoms, suppose he contaminated the meat ankunda. So when you bring the meat home, washing, and then you cook the meat, right? So by cooking, actually, most likely the virus is going to be destroyed. The other thing is, when you are cleaning the meat, right? You make sure to wash your hands and take the same precautions. It's not going to get into the air and get into you from the meat. Definitely not. But you follow the same precautions. Even though we are saying the incubation period is 14 days, but it can spread anywhere from 2 days to 14 days. The most common incubation period is about 5-6 days. So, but not CDC is not mentioning that, but I have seen some cases from China where after the exposure, after 21 days after the exposure, the test was positive. So it's not clear, but as per the CDC guidelines, it's up to 14 days. So if you think you had an exposure week ago or 10 days ago, monitor your symptoms, Sandy. Anything, whether it's from the butcher or whether it's from the Indian store or whether you went somewhere, you monitor your symptoms. If you don't have any symptoms, that's good. And if you have any symptoms, monitor your symptoms and call your healthcare provider. And take all the precautions, the same precautions, wherever you are going.
Thank you, Anavaru. So I think the caller, the texter must have got his question answered. So next to Manako caller Unnaru, Sandeep Garu, you're unmuted, you can go ahead and ask your question.
Thanks, Rupa Garu. Hello, Dr. Aruna Garu. Na peru Sandeep andi. So the question I have is, there is news that e virus it will reach a peak during a certain week, ani. So what is that peak season or peak of this virus? That's one thing. The next question is, once a person is tested positive, what is the meal plan? I mean, you should be drinking a lot of fluids, lapote you should avoid meats and complete meat and avoid cheseyali. Alanti a particular diet does doctors describe any such meal plan? Then is there a seasonal virus? I mean, is this going to be seasonal? This can come back again down the lane. Alanti symptoms virus. The last one is, does this virus live on objects? Imagine a lot of people are working from home, so people are ordering a lot of stuff. So say the droplets are there on a particular object. So how long does this virus live on that object, and what care should be taken on every? These are my questions, Andy.
Okay, Andy. So I try to remember, I think you asked it 4
questions. Yeah, a lot of questions, yeah.
Let me answer the last questions, whether virus stays on the objects and how long it stays. There is little controversy on this, Andy. There was one study that was reported in the New England Journal of Medicine, and they are saying they have like a different objects, plastic, copper, they're saying the virus can stay viable for few hours to few days. So I don't know what you get from there, but CDC is saying, that's not the main mode of transmission. But the precautions, that what I mentioned before is like, suppose you're receiving a packet, first they pack the stuff, whatever it is, and then it goes into different places and it comes to your home by one person. So it's changing a lot of people's. Suppose if the last person who is delivering your stuff has some symptoms on Kunma. So there is a possibility that it may be on the surface of the packets, but it's very unlikely what is CDC is saying. And the transmission from this mode is very less, they're saying. But on the precautionary side, my personal advice and what I am doing, I can tell you, if you get a packet, Tandy, don't bring the packet inside. You wear gloves, or you even use like grocery store bags, and open the pack. And inside of that, if you don't need it to be placed inside the home, you keep it outside at least for 2 days or 72 hours. Some people are recommending 24 hours, and then bring it inside. Otherwise, if you want to use it right away, you clean with the Sani wipes or any alcohol-based wipes and bring it to be on the safe side. And the same thing with the mail. My personal advice is, bring the mail inside with something on protection on your hands, and keep it somewhere. If you don't have to open the mail, wait for a few days, and then after that open it. And once you open the mail or whatever, you make sure you wash your hands. So the other question is this seasonal virus, right?
Mm-hmm.
Yes. Yeah.
This is not seasonal virus, Andy, and I hope it's not like a flu virus, even though it belongs to the same family as flu viruses. And I really hope it's not seasonal. This virus, it's predicted that it came from animals. It doesn't belong to human beings. But now we are seeing, whatever the way it came, either from bats or other animals, it's not like completely known at this time. The main aim is to stop the spread so that we can break the chain. That's why these lockdowns, and if these lockdowns are not followed properly, what happens is it keeps spreading. We are not able to break the chain, and especially this is this affected the whole world. So the main thing is to stop the prevention is the main thing. If I take the like the Spanish flu that happened in 1918, right? So at that time there were actually three waves of the virus. Initially they were affected. The wave is not that big. That means like not a lot of people were affected, and it had come down. And then the second wave was big, where like in the United States I'm talking about, where like millions of people were affected in the second wave. And that's when actually a lot of deaths happened. But part of the reason that wave was so peak, because it happened just before the winter time, like October or November, I'm not sure what exactly. So, and then there was also a third wave. So whether there is a possibility, whether we break up this and whether it can come back again, it may be, Andy. That's what, infectious disease specialists are predicting. In China, I think they reported some new cases after, cases were down. And so it depends on how much we follow, Andy. It depends on how much we are taking care, how much we are acting on, how seriously we are taking everybody. Even like some people take it, some people don't take it. We are not breaking the chain.
So everybody has to, అందరికి ఒకే రూల్ అప్లై అవుతుంది కాబట్టి అందరూ కలిస్తేనే ఇది ఫైట్ చేయగలుగుతాం అని చెప్తున్నారు.
What's the other question? And I think you had one more question.
I think Sandeep had one more.
Yeah, and meal plan gurinchi.
Meal plan.
Yeah, meal plan.
If somebody is infected, Andy, right now I didn't come across with any specific diet restrictions. If people are staying home, they can, normal diet they can follow, but follow healthy diet and make sure you drink a lot of liquids and take rest and stop spreading. So isolate yourself. Isolate yourself. If somebody is sick, there is a difference between quarantine and isolation. Isolation is like you completely stay in a room and use your own bathroom and stuff.
Okay. Thank you, Sandeep garu. Thank you, Aruna garu. So, next question, mana chat session nunchi oka question ochindandi. I'll open that up. Satish garu, go ahead.
Yeah, Aruna garu, already you touched upon two topics about letters, package, and food restrictions. So దాని గురించి నేను అది chat లో కూడా ఉన్నాయండి. So I'm going to ask that question again. Next question ఏమొచ్చిందంటే, this is from Murli D. How helpful are home remedies like salt water gargling and steaming in terms of reducing the chances of catching the virus?
Good question, Andy. As we mentioned before, I mean, this is only informative section, and I wanted to touch base with some alternative medicines, but CDC does not mention anything about alternative medicine, whether it's Ayurveda or homeopathic. I mean, if you take the home remedies, we do the salt water gargling, we do the steaming, for even common cold and flu. If somebody believes in it, you're not going to lose anything. It helps for symptoms. If you have a sore throat, salt water gargling definitely helps, and it also helps. The steaming also helps. So whether this is particularly useful for COVID-19, we don't have any data on that. So maybe it comes in the future about alternative medicine. I'm also very curious to know what's the role of Ayurveda or homeopathy in COVID-19.
Thank you, Aruna garu. That was well attended. So next we have a question from Arunasri garu. I think we'll open it up to her. Go ahead, Andy. Arunasri garu, sorry, Srivani garu. Srivani, you can ask your question. You're unmuted. Go ahead. So, in the meanwhile, I did get one question while we wait for Srivani. Can we eat seafood and buy fish?
Okay, so far on my research, I didn't come across any restrictions on the seafood or fish only. So I have not reported, I have not heard any cases that were reported eating seafood and fish.
Okay.
But to follow the same precautions, cleaning, washing hands, and proper cooking. You follow all the precautions with any kind of meat or seafood.
Okay. So, is the next caller ready? Srivani,
yeah.
You can go ahead and ask your question.
Yeah. Hi, Aruna garu. This is Srivani. I have a question. Like, if ఒక పర్సన్ లైక్ COVID-19 టెస్టెడ్ పాజిటివ్ పర్సన్తో రూమ్ షేర్ చేసుకుంటున్నా కానీ సేమ్ బిల్డింగ్లో కానీ ఉంటున్నప్పుడు అండ్ దట్ పర్సన్ ఈజ్ నాట్ క్లోజ్ కాంటాక్ట్ విత్ దట్ టెస్టెడ్ COVID-19 పాజిటివ్, అలాంటి సిచ్యువేషన్స్లో ఎలాంటి ప్రికాషన్స్ తీసుకోవాలి అండ్ ఆ పర్సన్ ఏం చేయాలి ఆ టైంలో?
ఒక్కసారి రిపీట్ చేయండి మీ క్వశ్చన్. సో suppose you are sharing a room with the patient who is
or a building, like I'm in same room or building who is tested positive for COVID-19, and during that situation what precautions should that person do and what exactly that person should do?
Okay, if the person is positive for COVID-19 and they have a roommate with them already exposed, and once they are positive, definitely they need to be isolated. For the person who is exposed to known case of COVID-19, they isolate themselves. Not isolation, but they quarantine themselves and they monitor for symptoms. If they are having any symptoms, you call the healthcare provider and they may get tested. If they are exposed and are having symptoms, there is a possibility that they might get tested. That's one of the criteria I think CDC was doing before. If somebody has a known exposure or a travel history and they're having symptoms, yes, they can be tested. If they are having symptoms. So if you don't have any symptoms, you can observe and stay away from other people, definitely.
Okay. Thank you, Amma. Thank you, Arna garu. Thanks, Srivani. So we'll open it up to a chat question, Andy. Satish garu, I think we'll take the question from the chat.
This question is from full name, initials, it's AR. The question is from one of their 8-year-old kid. Is there any chance of spreading COVID from humans to pets and vice versa? Pets meaning dog or cat.
Yes, Sandy. There is a possibility. I mean, if you are infected with COVID-19, you have to not only stay away from human beings, but also you have to stay away from pets, because there is a possibility that pets can get infected. So far, it's not reported in animals, with this pandemic going on right now. I haven't seen any reported cases of animals, but the recommendation is if somebody is COVID-19 positive, yes, they have to stay away from pets. You have to keep the pet also to be in the safe environment. It should not get exposed to either any human beings or the pets.
Okay, thank you, Arna garu. And next, there is a question on chat. Can I make a mask at home with cloth as per the tutorials I'm finding online? How should I clean it and the regularity of cleaning to keep it safe?
Okay, Andy. Good question, actually. Recently, the CDC is recommending, Andy, to use the cloth mask when you go to public places where you cannot keep social distance. So, or, they're recommending to use the face mask when you don't have symptoms and when you are going to the public places. It helps to some extent, but I don't say like if somebody is sick, like suppose you are sick and you're going to the doctor's office, so cloth mask is not recommended because you can still infect other people. And when you use the cloth mask, when you come home, take it out carefully, because you're not going to touch anything outside and then you wash your hands anyway, and you wash the face, cloth mask every time. That's the precautions you have to take with cloth mask. So different people are making differently. Some people are putting like a coffee filter, but there is a CDC site also. In the CDC, if you go under like a cloth mask, they have instructions how to make the cloth mask.
Okay, thank you, Arna garu. And next we will open it up to a chat question. After that, we have a caller. So Satish garu, go ahead with the next chat question.
The next question is from Sai Kauri. Is COVID airborne? Suppose my neighbor is tested positive and he sneezes or coughs in his backyard, and if I happen to be in my backyard, is there any chances of me getting it?
Good question, Andy. This is going on, like as healthcare providers, we have been looking into this since the beginning, whether it's airborne or droplets, other than contact, right? Airborne is something you get from the air. That means that the droplets we are releasing, right? There are small droplets and big droplets. The big droplets, of course, they don't stay in the air, they drop down and they fall on some places, whatever it is. But these small droplets, tiny droplets, they can linger in the air for some time. So, there is a little controversy on this. Initially, they said airborne, and for airborne, we have to use the masks in the hospital setting. I'm talking about N95s. But in the backyard, again, Andy, even with the small particles and airborne, the distance more than 6 feet, it's very unlikely you're going to have through airborne if it's more than 6 feet.
Okay, thank you, Arna garu. That was Sai Kaur's question on chat. Now we have a 15-year-old who wants to ask a question. Jaitra, you're up. You can ask the question. And then we have a question on text as well. So Jaitra, go ahead and ask your question.
Hey, yeah, I was just wondering, let's say I wanted to go out and play in like my backyard or front yard. Like what precautions should I take while like still being physically active? Thanks.
Okay. So it is important, to be like as usual physically active and it's healthy, as long as you're not with a group of friends and you're not together with like a group of people, you can happily play outside. You play as usual and, you come home and you take all the precautions. I hope it answered your question. A lot of kids are asking, why can't I, go with my friends and play games? It depends on, as I mentioned before, if you come up with like any games that does not involve physical contact and you are maintaining your distance, it's acceptable. But you're playing basketball, there is a lot of interaction between the two boys or two, but if you play, at distance and you're using your own ball and own basketball or something, that's safer. So, maintaining the distance and the hand washing after, again, the same things. But as long as you're in close contact with other people, you can play outside, no problem.
So basically without contact sports, so we're not doing contact sports. Okay. Thank you. I think a lot of kids.
The outside air is very diluted. Even if we're talking about like, somebody walking by and they're spreading, it's very diluted as compared to a patient room or in a closed room. If somebody had like some symptoms, it's very unlikely. The chance of getting, transmission is very high in a non-ventilated room where you are in close proximity with the people. But outside, it's lesser risk, definitely less risk.
Thank you. Thank you, Jaitra. Thank you, Arnagaru. Now we'll open it up to a chat question that we got. Go ahead, Satisharu, and then we'll go to text.
This is more of a statistics question from somebody called AR. There are so many COVID cases here in the US. Any idea what percentage of Indians have COVID-19?
Actually, I was also curious, Andy. I was looking whether they are, doing any data like that, racial, on races or, Indians like versus white people versus African American people. I didn't come across, as so far this virus can affect anybody. I have, we heard, some of the Indians were also affected. There are also theories I'm hearing behind, but nothing is proved. So the anti-malarial medications we have taken previously, whether they have some role in developing immunity, I don't know how. And the BCG vaccine we have taken, because in Russia, I think where they also had BCG vaccines, there is some people think there are less number of cases because of the vaccine, and there are less number of cases in India because of some kind of immunity. There are some reports I'm hearing, and there were, something that there is a, special gene that Indian people may have it. If we have it, that's well and good, but so far it's not proved. Whether the food we are eating is making any difference in developing the immunity for this kind of virus. It's not known, and it's not proved anywhere. And but there is some controversial thoughts about India. There are less number of cases because I think they acted fast. So far, knock on the wood, and we don't know what's going to happen. But I think people are taking seriously there than here. That's what my feeling is. I think we should have taken seriously, and we should have done, even though even now it's not late. So please follow all the instructions and keep the social distance. And this is the main priority. going to grocery store and getting milk, or going to Indian store, getting some stuff. That's not the priority right now. You can manage in other alternative ways. If suppose like you have an elderly person and medications need, in those cases, you go with precautions that you have to go to the pharmacy store, or you need a baby food or something that you don't have opportunities or for delivery or something. Then in that case, baby food is the priority. Medications for an elderly parent is the priority. But at that time, like, you take all your precautions. You follow social distance, if you have a cloth mask, wear the cloth mask. But they're not recommending when you go out to wear a surgical mask or N95s at this time. CDC is not recommending because there is still very shortage of masks.
For health professionals, yes. Thank you, Andy. So there is one question that we have gotten from text, that is, are there current recommendations on international travel for personal reasons, like if somebody dies or if something happens, for personal reasons, emergency reasons, if they open up, there are any current recommendations on international travel for personal reasons?
Yeah, I think it was on March 19th, Andy. They announced it as a global warning. I think it's level 4 warning or something for all international travelers. So they're not recommending. So if there is a personal reason, but there is a warning there too. There is definitely an international warning anywhere internationally. So far, there is no such a warning for our domestic traveling, but you have to be careful even for domestic traveling, because now it's everywhere. But if you really have to go for a reason that you cannot avoid, you have to take extra precautions.
Okay. So do we have a caller? I think Sharanya Garu, you're unmuted. Please go ahead, ask your question. Sharanya Garu?
Yeah, Rupa.
Sorry, we can't hear you. And ఒకసారి మళ్ళీ అడుగుతారా? Sharanya Garu?
Rupa, I don't have a question. It was an accidental hit.
Oh, okay. Okay. No problem. Thank you. So I think we will go to the next question on chat. Satish Garu, you can go ahead and ask the next question that we've received on chat.
You already briefly touched upon this, but multiple times it's in a question. What is the best way to sanitize grocery? This question actually is from Sarita Kolli. Best way to sanitize grocery, how to clean all the grocery, the perishables, the vegetables. There are so many mixed videos to clean grocery in dishwashing, soap, hot water, leave it in the garage. What are your suggestions?
Okay, that's a good question, Andy. I know there is a lot of different people are posting, different versions. But as I mentioned before, as per CDC, the risk of transmission this is lesser. But, as a precautionary, things like you can keep on the side and you don't have to touch, you keep them and you don't touch at least for 72 hours, because we don't know at this time, it's not clear how long, if there is a virus on the surfaces, how long it can survive. As I said before, they're saying it's from few hours to few days. So some people are recommending for 72 hours. That was only reported in the New England Journal of Medicine, one of the article, but CDC and WHO, they are saying like it's very minimal transmission, very less chance of transmission. But vegetables, like anything that goes into the refrigerator, you make sure you wash them, properly. And if you don't have to, if you can, don't use them for 2 days or 3 days, wait like until you use them. And when you're cooking, you're destroying, it's good. I mean, if you're properly cooking and stuff. So then every time you handle the vegetables or any of the stuff that you bring from the grocery stores, you be careful. Wash hand washing, and your clothes. You take shower and you wash your clothes. Those are the precautions I personally advise, but these are not from CDC. But that's what I would do, because the way the virus is going, we have to take every precaution. That's what my personal opinion is.
Okay. I think on the text also, we received a question which is very similar. I think it touches the same subject. How long does the virus survive on surfaces? If you want to touch on that as well.
Yes, that also depends on the surface and also the environment and the temperature and the humidity. I think these are all the factors. This virus, it has a lipid layer on the outside. As you know, many viruses, they cannot live by themselves. They need some kind of human cells. So the fat layer, these disinfectants can disrupt the fat layer and the virus is dead. These alcohol-based ones, you can, hand and, soap and water, it cleans away the stuff, and the disinfect, both of these things will work. But how long it stays, I mean, what I'm getting is from few hours to few days. I didn't hear more than 72 hours. Usually they say 48 hours. Actually, I can read the New England Journal of Medicine article, but CDC is not saying the same. So they say they can live in the air and on surfaces between several hours to several days. The study found that virus is viable for 72 hours on plastic, 48 hours on stainless steel, and 24 hours on cardboard.
This is what the New England Journal of Medicine says.
But, CDC is under WHO, they're saying this mode of transmission. It's not clearly known. That's the fact. It's not clearly known how long the virus is viable outside.
Okay, thank you, Arnagaru. So now we'll open it up to a chat question, unless there is a caller. Satish Garu, you can go ahead.
Arnagaru, your answers are very nicely received. The chat questions are increasing. This you already touched upon. This is from Shiva Indrakanti. Can I go for a walk with my own family in the neighborhood? Is it advisable, considering that this is an airborne vulnerability?
Okay, Andy. This question actually a lot of people are also asking. Actually, Rupa Garu asked last time when we were talking. Before, I would say it's safe, as long as you're going with your family members who they have been in the home without getting any exposure outside, and you are maintaining your social distance when you go outside. It's safer relatively, and the risk of, even if somebody is transmitting in the air, the risk is very, very less. Because as I said, outdoor, it's very diluted. Somebody was asking also, if the wind blowing to me, if somebody is on the other side and there's a blow of wind towards me, is there a chance of getting? It's very less, Sandy. If you are concerned, wear the cloth mask. All of your family members, you can wear cloth mask. It can prevent to some extent. But going outside, outdoors, as long as you're maintaining distance, the risk is very minimal.
Okay. There's one more question from Lakshmi Garu. Can a person get infected with COVID more than once?
Okay, that's a good question, Ali. Actually, this virus belongs to a family of viruses, which we have studied before, right? So some of these viruses, once you get it, you get immunity for lifelong. I mean, you get immunity, you develop antibodies. That's the basis. Now, I don't know how many of you heard, for people who are severely sick and they are in ICUs, they are experimenting on the plasma, donation of plasma from people who recovered COVID-19. So thinking that antibodies that are produced from this virus is going to help to this person who is severely sick, severely who is like, life-threatening conditions. Like for those kind of patients, they are again like, I heard like today, Houston, they're getting a lot of results. So based on that, there is a possibility that we develop immunity for the virus. And it's unlikely, as per Dr. Fossil, like infectious disease director, right? At one time he mentioned there is a good chance like we don't get infected again. But I'm not sure how true it is. In China, there was a reported case that was COVID positive previously, and then again was positive again. So again, I think we need more time on this. I think we need more studies on this. But if this virus behaves as everybody is expecting, we should not get it reinfected. We should develop immunity.
Oh, thank you, Arnavara. So I have a question, like it's a little long question, but I'll cut it short. I think temples are open, and on Facebook Lives, I don't see them wearing masks as of yesterday. Recently, she doesn't want to name herself. Recently, I had a priest perform puja in the house 10 days back. Now I'm worried. That's it. That's the question.
So if you had only one priest and he doesn't have any symptoms, and you didn't have a lot of group of people in the house, again, the chance is less. But at this time, everybody is recommending, don't invite any guests, because you don't know, because they might be having it and they don't have symptoms. So as long as you're keeping distance, suppose if somebody doesn't have any symptoms, right, and you're maintaining the distance, it's minimal. It's very minimal. But temples, lot of temples that I know are closed only, and even if they go to the temples, like you maintain distance. You cannot be like close together like what we were doing before, but everybody has to be 6 feet apart. Like in my work, we have meeting every Friday. We are maintaining social distance. None of us have symptoms, but we make sure like we sit 6 feet apart at least.
Okay, thank you, Andy. So yeah, the next question is going to go for chat. Go ahead, Satish.
This is speculative. This question is from Naga Nallagaru. Is remdesivir the closest drug so far for COVID? I read it's experimental at this point. What does that mean? When do we think it will get approved?
I think that's about an experimental drug, like I mentioned earlier, but it's up to her if she would like to take the question. We can't comment on
this treatment law. Indaka mentioned chesinapudu, there is no FDA approved treatment as far as now, but in the hospitals, I have a report of the protocol from Mass General. Multiple hospitals, they are following different protocols depending on the severity of the disease. Only for severely ill patients who are on the vent. People have tried these antiviral medications. One of the HIV medication, hydroxychloroquine combination with Zithromax. And people are using different regimens when there is no other choice, but it's not FDA approved. If they are still, as you said, it's still under experimental. We hope we get an answer soon, and the same thing with vaccination.
Okay, thank you, Andy. I see a caller, Satish Karan, if you want to.
Sure, 1 second. Okay, Mani
Garu, you're unmuted.
Yeah,
go ahead and ask.
Yeah, unmute. Thanks, Aruna Garu, taking this call for the community best. And I want to ask you a question. Even though a couple of people are getting COVID, 91, but the thing is, couple of them are recovering. So what is that mean to select? So the medicine is working now. Like, what does that mean? Do that have a medicine now? How are they recovering?
Okay, Andy. It's a good question, Andy. I think one of the kid earlier asked.
That question. How are people recovering?
People are recovering, Andy. Not couple of people, Andy. 80% of the people. Like suppose 100 people get affected, approximately 80% of the people without any treatment, Andy. Without any treatment, they recover nicely. The mortality rate, the number of people that could die from this disease is right now, it's only 1 to 2%, which is a lot. But a lot of people are recovering. That's the good news. That's the positive thing we have to think also. But even the people who are sick that goes to the hospital, out of them, not all of them are in dangerous situations. I think only 5 to 10% of people are in critical. And out of those also, it also depends, and it depends on the age of the people, number of chronic conditions, because once they go into, there are stages of illness. Once they go into that critical stage, in that case, the recovery rate is getting lesser. But not couple of people, and a lot of people will recover from this disease. Even if people have, as I said before, not everybody who has symptoms have COVID-19. Even if people have COVID-19, most of them recover without any complications. Only certain percentage of people only. And the treatment, as I said, there is no approved treatment. All the people who recovered, they may not be on any treatment, but they are still doing experiments. And some of the hospitals, even though it's not approved by FDA, but they are trying. They are trying when there is no other option.
Thank you. Doesn't have a medicine, but you guys are treating, right? There should be some medicine, right, for treating?
The medicine is, there is no approved medicine right now, or there is no approved vaccine, but different hospitals, they're following their own protocols. Depending on the situation, depending on the patient's condition, depending on the availability of the medication. Yes, they are trying different medications, but we don't know the effect of them yet. It's too soon to know whether these medications can be tried on everybody, because all of these medications which they are experimenting have side effects, and they are toxic medications. So it has to be careful under supervision of multiple specialties, multiple specialists. So it's
Thank you, Medial.
Thank you so much.
Thank you,
for your help.
Aruna.
Thanks, Rupa and Satish.
Thank you, Andy.
Organizing this event.
Sure, you're welcome. Thank you. Satish Garu, I think we have a chat question. After that, we'll go to text. We have one question on text. Go ahead, Satish Garu.
Aruna, this question is from somebody initial MK. This is from their 7-year-old son, Snithik. What is the root cause of COVID?
What's the root cause of COVID? That's a good question, Anna. A 7-year-old. So the root cause of this COVID-19, what they think right now is the source of this virus is from the animals. So they're thinking it may have come from bats, but it's not completely known. As you know, the cases have originated in China, in a place called Wuhan. They think that it has come from the live animal market, where they sell this meat and animal meat and stuff. So because a lot of people were affected from that market in the beginning, so that's where it originated. Whether it had come from an animal which was imported to Wuhan, there is some theory also about that, or whether it is from bats or whether it's from some other animals. Usually a lot of these viruses, they belong to, suppose, we have before like SARS and, Ebola virus, they all belong to the animals. But from the animals, whatever the disruption happened, it's transmitted to humans. So this was never found in human beings before. That's why it's called novel COVID-19.
Thank you, Arna garu. That's an interesting question from a 7-year-old. They all must be wondering, kada, ela ochindi, identi, enduku ante. So, MK gar question answer ayindi. So, one question we do have on text is, I have symptoms, but I did not get tested. How long do I need to stay isolated?
Okay, Andy. It depends on what symptoms you're having. Are you having just like, nasal congestion, cough, and no fever? It depends on the symptoms. If your symptoms are alarming symptoms and you have an exposure or something, then you will need to be isolated yourself or quarantine yourself for 14 days. If you have alarming symptoms like fever or known exposure or something like that. If you have no alarming symptoms or something like you have milder symptoms and you have fever, all the symptoms of COVID-19, and you are not tested, you have to be quarantined at least for 7 days after your start of symptoms. That's the minimum. And if you have to be like fever free for 72 hours. And without any symptoms. So 3 things: if you have milder symptoms, at least 1 week from the onset of symptoms, and you have to be fever free, and also you free of symptoms.
Oh, thank you.
If somebody was going to be tested, suppose somebody were tested already and they were positive and they are home and they isolated themselves, when can they come back from isolation? So in that case, same thing. They have to be fever free, symptom free, and also they should have tested negative 2 times. So they can come out of isolation. So that's the recommendation I found from the CDC.
Okay, thank you. And as it's 4:45, we'll take like 2 more questions or 3 more as time allows us. Samaya bhavam mulana chusi manakunna kuda konne migilni. We've attended most of the questions. And డెవలప్ అయిన క్వశ్చన్స్ ని మనం కలుపుకుంటూ వెళ్తున్నాము. సో చాట్ లోని వచ్చిన couple of questions సతీష్ గారు అటెండ్ చేస్తారు. సతీష్ గారు.
This question is from Banu Tatineni. What are the precautions for autoimmune disease?
Autoimmune diseases. Okay. Autoimmune diseases, it depends on most of the autoimmune diseases, people are on medications. Those medications can suppress your immunity. So you do come under high risk patients. As I mentioned in the earlier slides, any chronic medical conditions like heart problems, asthma, chronic lung problems, who are a smoker, who are a diabetic, even obese people are at high risk. Immunocompromised patients like HIV patients, and organ donation, like somebody had organ recipients, transplants, recipients, or dialysis patients, or people who are on prednisone, which is an immunosuppressant chronically, and there are a lot of other immunosuppressed medications. All these patients come under high risk, so you have to take extra precautions. Like if suppose you are in a home and other family members, if suppose somebody is a healthcare workers and you are in the same family where they are getting exposed, so you have to be in a different room. You have to be isolated because you are at very high risk. If the exposure is less, you follow the standard precautions, but you will be extremely careful when you go out. It's not recommended to go out at this time. Take all the alternative things to deliver, or things like that.
ఓకే, థ్యాంక్ యూ అర్ణ గారు. ఇప్పుడు క్వశ్చన్ తెలుగులో వచ్చింది. మా అమ్మగారు నాన్నగారు ఇండియా నుండి వచ్చి ఉన్నారు. వాళ్ళకి మా అమ్మగారికి పొడి దగ్గు, ఆస్తమా ఉంది. నేను ఏమైనా జాగ్రత్తలు తీసుకోవాలా? వారి మెడికేషన్స్ అయిపోతే అవి రీఫిల్ చేయించుకోవడానికి ఇక్కడ కుదురుతుందా?
ఇన్సూరెన్స్ లేదా?
I think so. I think that's what it means.
That is a difficult situation, Andy. as I said, asthma ఉన్న వాళ్ళకి కూడా they come under high risk category, and they have to continue their medications definitely. So medications అయిపోతే మీకు ఎలా వస్తాయి అంటున్నారా?
ఐ థింక్ సో. అంటే ఒకవేళ అయిపోతే అవి రీఫిల్ చేయించుకోవడం అవ్వాలి కదా, సో అది ఎలా?
రీఫిల్ డెఫినెట్ గా చేయించుకోవాలండి. అంటే మీకు తెలిసిన డాక్టర్స్ ఎవరైనా ఉంటే, లాట్ ఆఫ్ పీపుల్ దే డూ టేక్ పీపుల్ విత్ నో ఇన్సూరెన్స్. If you know any pharmacy people, like they can help you out. It's very difficult to get the medication because I have another situation like this too, where somebody
I got some calls too about actually ఇది చాలా మంది నన్ను కూడా అడుగున్నారు. అంటే వచ్చి ఉన్నారు పేరెంట్స్, తల్లిదండ్రులు వచ్చి ఉన్నారు, వాళ్ళకి కొన్ని అంటే లైక్ డయాబెటీస్ అండ్ హై బ్లడ్ ప్రెషర్ మెడికేషన్స్ తెచ్చుకుని ఉన్నారు, కానీ బికాస్ దేర్ ఇంటర్నేషనల్ ఫ్లైట్ వాజ్ అవుట్ బౌండ్ జస్ట్ రెస్ట్రిక్షన్స్ ప్లేస్ చేశారు కదా, వాళ్ళు వెనక్కి వెళ్ళడానికి లేదు, వాళ్ళ మెడికేషన్స్ అయిపోతున్నాయి, ఇప్పుడు ఎలా తెప్పించుకోవాలి? విజిటర్స్ ఇన్సూరెన్స్ ఉంది కానీ వీ డోంట్ నో హౌ టు గెట్ దెమ్ ఫిల్డ్, అది కవర్ చేయదేమో, అలాంటివి వస్తున్నాయి. ఐ థింక్ యువర్ అడ్రెస్సింగ్
డిఫికల్ట్ సిచ్యువేషన్. అంటే ఇలాంటి సిచ్యువేషన్ ఎప్పుడు రాలేదు అండ్ ఎక్స్పెక్ట్ చేయలేదు కదా, ఇప్పుడు ఇండియా నుండి కొరియర్ అట్లా లేదు. బట్ దేర్ ఆర్ లాట్ ఆఫ్ జనరల్ మెడికేషన్స్ అవైలబుల్, యాజ్ ఎవ్రీబడి నోస్. They are less expensive, and if you know any doctor's office, it's also difficult to get an appointment for the new patients because they are not taking any non-urgent patients. But this is kind of important too, not to miss the medications. So you can work out with any people like who are practicing outside in the office, and also we do have some pharmacies around. You can get some help if they can help you out.
Okay, thank you Andy. So next to Satish Garu, I think next 5 minutes we can wrap up with the questions. You have a few questions on chat. Go ahead, Andy.
Yeah, I think we should wrap up the last 2 questions, Andy. This is from Jitendru Raju. Arunagaru, I contracted flu and pneumonia in the first week of February after my travel home, and he came back via Middle East. I still cough whenever it's slightly cold due to the spring allergies. I'm 40 years old. I do not smoke. I'm very active. Do I get tested? How risky am I? He feels short of breath on runs, unlike before. So he's doing yoga and nebulizer. What can I do more? I'm in self-quarantine.
Okay, first week of February. So this is almost like close to 8 weeks kadandi.
Okay.
Ante COVID-19, if you had exposed to COVID-19 8 weeks ago, ante so far as per the current incubation period, you are out of that range. But if you were diagnosed with pneumonia and flu, I think you mentioned, right?
Yes.
You talk to your healthcare provider, Andy, and make sure, because the flu and pneumonia, sometimes the symptoms can linger for some time, but as long as you don't have fever, watch for those alarming symptoms. Like whether you're having fever, your cough is getting bad, it's highly possible also allergies. So you take the allergy medications, and if it's not better, you take all the basic medications what you're taking, whether you have asthma or seasonal allergies, whether you take inhalers, if you're taking usual medications, and if the symptoms are not going away, and you have any alarming symptoms like fever, new shortness of breath, or those things, like you talk to your primary care or healthcare provider and they will guide you. But I don't think you will meet the criteria for the testing based on your symptoms. But again, you make sure.
Again, correction, Andy. I think he said he is in self-quarantine since March 1st, not from Feb.
Oh, March 1st.
So it's like 4 weeks or 4 to 5 weeks right now.
Okay. Yeah, but even then, Andy, he's beyond 14 days. So as I said before, when you come out of the self-quarantine, is like if you don't have fever, you don't have symptoms, and you're after 14 days of self-quarantine, you can come out of the self-quarantine. But your symptoms, you have some symptoms which looks like non-specific symptoms, like breathing problem only when he's exercising. So I'm not sure whether he has asthma. But
yeah, I think they can talk to the healthcare professional, like we mentioned, because asymptomatic treatment, a little bit we can do it and address it on the webinar. But like she said, I think as it gets deeper, you would want to or talk to your healthcare professional. And there is one more question on chat that Satish Garu will ask. After that, we are going to wrap it up. Satish Garu, go ahead.
Yeah, I had this similar question. This is from Raj. Would you say this virus will get killed due to the higher temperatures?
Okay, Andy. That is also not, we don't have a reliable source or reliable study what temperature this can be killed. But there was, they were assuming that high temperatures will kill the virus. But the thing is, if you're talking about the virus that is outside, on the surfaces, yet it might be killed. But, a lot of times we are bringing that inside. It's going into our body. So temperature, I don't know how much it's effective with the temperature. So not known, only it's not known yet, but they were thinking hopefully the virus will come down when the temperature rises up. But we are seeing cases in India, not as much, but I don't know whether temperature is a factor. So it's not clearly known at this time.
Okay, thank you, Arna Garu. There's one last question on text. Is it safe for me to run because it is not possible to wear a mask and run? I'm a runner, so how safe is it?
Okay, I think we mentioned this before too, and if you are going,
yeah, I think running as it's not a contact sport and adinattunnaru.
Not with group of people.
By themselves they can run.
Yeah, and you are maintaining social distance. Yes, okay. It's relatively safer, and the risk is very minimal as per the current guidelines. Our guidelines are changing now. It also depends on the location where you are. If you are in a community where there is a highest rate of COVID-19, the recommendations are changing. Every day we are changing. But so far, outdoor activities by yourself, they are relatively safe and the risk is minimal.
Okay, thank you, Arna Garu. Deento we have taken actively a number of questions and you have been very patient. Chala chakkaga samadhanalanni icharu mana Telugu Association of Greater Charlotte area varki. Thank you, Satish Garu. And for now అయితే ఫ్యూచర్ లో కూడా మనం కొన్ని వెబినార్స్ చేస్తున్నాము. సో ఎవ్రీ సండే వి విల్ ట్రై ఫర్ హౌ లాంగ్ అన్నది వి డోంట్ నో, కానీ వచ్చే ఆదివారము మిగతా క్వశ్చన్స్ కి కంటిన్యూ చేస్తాము. ఇన్ ది 1 hour దట్ వి విల్ ఓపెన్ అప్ టు క్వశ్చన్స్. డాక్టర్ నాగమాల చల్సాని విల్ బి అవర్ హోస్ట్ స్పీకర్. And we will announce it on social media as well as look out for the email ద్వారా కూడా మీకు పంపిస్తాము ఇన్ఫర్మేషన్. అండ్ అందరికి అడిగే క్వశ్చన్, అందరూ దాని గురించి ఇప్పుడు ఎక్కువగా ఆలోచించి లవ్డ్ అండ్ నియర్ అండ్ డియర్ వన్స్ ప్రొటెక్ట్ చేసుకుందామని చెప్పి వీల్నామా రాసుకోవడం చాలా మంది మర్చిపోతారు, ఆ టాపిక్ టచ్ చేయరు. సో విల్ అండ్ ట్రస్ట్ వెబినార్ కూడా ఏప్రిల్ 10వ తారీఖు 4 నుంచి 6 గంటల వరకు we will have a couple of people from that field who will be doing the webinars. So please do attend. So andaru parishubrata పాటించాలని అరుణా పెద్దిరెడ్డి గారు మనకి ఎంతో టైంని, విలువైన టైంని మనకి కేటాయించి మనకి ఇంతసేపు చాలా పేషెంట్ గా ఆన్సర్స్ ఇచ్చారు. సో ఆ విలువైన అభిప్రాయాలన్నీ మీరు తీసుకుని సిడిసి గైడ్ లైన్స్ ప్రకారం మేము అది ఫాలో అవుతూ, యాజ్ షీ సెడ్, ఎవర్ చేంజింగ్, ఇది ఒక ఎవర్ చేంజింగ్ సినారియో కాబట్టి దాని ప్రకారంగా చెప్పున్నారు. సో ఇఫ్ యూ హ్యావ్ క్వశ్చన్స్ ప్లీజ్ కాల్ యువర్ హెల్త్ కేర్ ప్రొఫెషనల్ లైక్ షీ సెడ్, అండ్ ప్లీజ్ డూ all the safety precautions that she has given. These are all just guided guidelines from the CDC, and please stay home, stay safe. And Aruna Garu, again, thank you so much.
థ్యాంక్ యూ సో మచ్ అండి. ఈరోజు నాకు ఈ అవకాశం ఇచ్చిన తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లట్ ఏరియా అధ్యక్షులకి సతీష్ దండమూడి గారికి, ఆర్గనైజ్ చేసిన మీకు అందరికీ నా ధన్యవాదాలు. దీంట్లో పార్టిసిపేట్ చేసిన ఆడియన్స్ అందరికీ చాలా థ్యాంక్స్. అండ్ ఐ హోప్ ఐ ఆన్సర్డ్ యువర్ క్వశ్చన్స్, whatever I know at this time. And I know there are a lot of unanswered questions, and hopefully we can get the answers soon maybe if it gets updated in the next few sessions that Telugu Association is doing. So మీరు చక్కగా ఆరోగ్యంగా చాలా క్షేమంగా ఇప్పుడు మనం ఇచ్చిన అన్ని సూచనలు, ఈ లాక్డౌన్లు ఇవన్నీ ఫాలో అయ్యి స్ట్రిక్ట్గా ఫాలో అయ్యి సో ఫాలో అవుతారని
దానికి ఐ విల్ యాడ్, అరుణ గారు చెప్పినట్టు చేతులు తరచుగా పరిశుభ్రంగా కడుక్కోండి. ఒకవేళ మీకు పొడి దగ్గు అలాంటివి ఏమైనా కలిగితే మోచేతుల్లోకి దగ్గండి. మాస్క్ ధరించడానికి ప్రయత్నించండి. ముఖం ముట్టుకోరాదు. 6 అడుగులు మినిమం దూరం నిర్వహించండి. స్టే హోమ్, స్టే సేఫ్ అండ్ ట్యూన్ ఇన్ టు TAGCA ఆన్ ఫేస్బుక్ and Instagram, social media, and look out for the emails. మీకు ఈ వీడియోస్ కూడా హెల్త్ కేర్ ప్రొఫెషనల్స్ నుంచి మేము ఎప్పటికప్పుడు రిలీజ్ చేస్తూ ఉంటాము. తప్పకుండా మీరు అవన్నీ చూసి సేఫ్ గా ఉండాలని TAGCA తెలుగు అసోసియేషన్ ఆఫ్ గ్రేటర్ షార్లట్ ఏరియా వారు కోరుకుంటున్నారు.
నమస్తే అండి.
థ్యాంక్ యూ సతీష్ గారు.
Thank you. Yeah, I'm closing this session.